Ankylosing spondylitis is one of the common problems which affects the spine predominantly and also the other joints in some patients. The word ankylosing is comprised of the word ankylosis, which means formation of a fusion. So this disease results in the fusion of the components of a joint, leading to lack of flexibility and rigidity in the body. Generally, ankylosing spondylitis starts off either as a back pain or as a neck pain, and in rare cases also with pain in other joints. It is different from rheumatoid arthritis in the basic way that the place in the joint that is affected in ankylosing spondylitis is different. While in rheumatoid arthritis, the inner layer of the joint, which is called as the synovial membrane, is the area that is affected. Whereas in ankylosing spondylitis, the main area that is affected is the spondylitis, which is the insertion of the muscles or tendon into the joint. So it is either the capsule or the tendon and the ligament, which is part of the joint, that is affected by inflammation. The manifestation is by way of pain in the joint that is affected. The most common joint that is affected by ankylosing spondylitis initially is the sacroiliac joint, which is the back, which is at the back. It can also manifest as pain in the neck, and later the problem spreads through the different vertebrae, gradually limiting the range of movement that is possible by the patient. The rigidity develops in the body and the patient is not able to even sometimes maintain the neck in the normal position. They become stooped. They are not able to be flexible. They are not able to move themselves. They find it difficult to turn in bed and so on and so forth. As I said earlier, some patients also have the systemic manifestations, like they also have joint pains. This is also a form of autoimmune disease where the body's immune system attacks the joint, gradually degenerating the joint and disabling the joint. What is happening in the case of the vertebral bodies is that the ligaments and tendons that are attaching the vertebrae get fused, they sort of get calcified, and it becomes like a bone, thereby preventing any sort of movement between the vertebrae. This is called as a bamboo spine appearance, and this is a very severe stage of ankylosing spondylitis. In the normal condition, ankylosing spondylitis keeps aggravating with time, and that is why it has to be treated very effectively right at this stage when it is starting off. If the intervention is started early on, there is a great possibility to slow down the progress of the disease even with modern medicine. Modern medicine predominantly starts off by using anti-inflammatory drugs to keep the patient moving. In case it is not under control with anti-inflammatory drugs, disease-modifying drugs like steroids, sometimes using other methotrexate, sulfur-salicylic acid and so on and so forth. There's a whole range of disease-modifying anti-rheumatic drugs that are also used to keep ankylosing spondylitis under control. But all these drugs are very powerful and are also associated with several side effects, which limits its use in the long term. And ankylosing spondylitis is not a disease that gets cured within a short period of time. Thereby, these powerful medicines are to be used for a long period of time. There are several patients who don't come under control even with this and need to use biologicals, which are specifically created antibodies against agents that are part of the inflammatory process in the body, like TNF-alpha. So these biologicals are created and they are given administered as injections, and they interfere with the ability of this immune system to create an inflammation and thereby to damage the joint, and that's how the joint is protected by these biologicals. They form a very important and very effective mode of treatment in preventing damage to the joint and in improving the quality of life, but they also have side effects like they bring down the immunity of the system, and thereby the patient is extremely prone to several other infections. In the Indian context, it's very common for them to get an attack of tuberculosis. So that limits the use of these drugs. In addition to that, biologicals are extremely expensive and cannot be afforded by a majority of the patients because they need to be used every month and they are extremely expensive. It is in this context that several people approach Ayurveda as a holistic treatment for ankylosing spondylitis. Ayurveda understands ankylosing spondylitis under the spectrum of inflammatory diseases, and Ayurveda offers a very holistic solution. Ayurvedic herbal preparations combined with Ayurvedic therapeutic procedures like the oil massages. We have several forms of inducing the peripheral circulation. We have treatments that are able to bring down the immune response in the body. The most important of them is the procedure called Vasti, or medicated rectal administration of herbs. We prepare decoctions or milk that is medicated with herbs along with certain oils. Medicated oils are administered through the rectum, and they are seen to act on the system, and they are able to bring down the inflammatory response in the body and keep the patients in a state of remission. The acute inflammation is reversed and the patient's flexibility and mobility is improved with regular treatment with these Ayurvedic treatments. A course of treatment followed by regular medication, oral administration of herbal Ayurvedic medicines is able to keep most of the patients normally functional without the need to use either anti-inflammatory drugs or disease-modifying drugs or biologicals. So in that way, Ayurvedic treatment has been very effective in treating. We have experienced several patients who have had complete remission of their condition for years after about 2 to 3 courses of Ayurvedic treatment, in spite of having suffered from the problem for several years. We have had patients who have been suffering from the problem for 5 to 6 years, and even with the medication they were not under control. And after 3 sessions of Ayurvedic Panchakarma therapy, we have seen them remitting to a very normal level and leading normal lives. They continue to take some herbal medicines and apply oils and so on, but they don't need to take the powerful anti-rheumatic drugs, and they are able to lead a very good quality of life. This is what we offer at AVN Arogya Ayurvedic Hospital and at our network of clinics which are situated in Madurai, Chennai, Bangalore, Mumbai and Cochin. We have this effective, the whole range of Ayurvedic therapies comprising of the Panchakarma and the Upakarma therapies, and the whole range of Ayurvedic herbal preparations. It's very important for us to explain that we don't use any products with heavy metals or products which are of questionable safety. All our products are based on traditional formulae, the oldest of them, which are based on only the herbal preparations. And so people are able to use these herbal preparations over long periods of time without having any particular side effect or suffering from any other issue. And this is able to keep them in a state of remission and much improved flexibility and quality of life without the use of powerful drugs. AVN Arogya Ayurvedic Hospital, 175 Villacheri Main Road, Madurai 625004, Tamil Nadu, India. Call +91 9025 700 400. URL www.avnarogya.in. Centers in Chennai, Bangalore, Mumbai, Cochin, Madurai and Malaysia.